Welcome to Inclusion Matters, produced by the Center for Inclusive Childcare,
aka the CICC.
We're located at inclusivechildcare.org.
Hi, welcome to Inclusion Matters, a podcast of the Center for Inclusive Childcare. I'm Cindy Croft, Director of the Center, and I'm here again with one of our inclusion consultants, Priscilla Weigel. Welcome, Priscilla.
Glad to be here, Cindy.
And we are so excited to have a guest with us today, and Priscilla is going to introduce her. And we're very excited to start a series on young children and autism spectrum disorders. So I'm going to let Priscilla take it away right now.
Great. Well, we're thrilled to have Pat Pulice here with us, and she is the Director of Autism Services for Fraser. And we've worked together for over 25 years, and she's just a wonderful expert on children with autism, and she does a lot with coordination of services over at Fraser Child and Family Center. And we're thrilled to have you here, Pat.
So we thought we'd start, Pat and Priscilla, with talking about children with autism and maybe looking at, first of all, what autism really is for the people who are listening, kind of to get a better understanding about it and maybe some of the major sort of elements or characteristics that might be seen in autism or a child with autism.
Sure. So autism is a neurological developmental disorder of unknown cause. So when we start with that definition, we're really identifying that there's no medical test. You can't do a blood test. You can't go into a clinic and do a quick 10 questions and you have it or you don't. It's really a spectrum disorder, and because it's a spectrum disorder, we see such a wide variety, and it's very confusing for really the community at large to identify, does a child have it or don't they have it, especially in the very young years. Mm-hmm. But there are some basic core features. One is that there are some difficulties in communication, difficulties in interaction, and also difficulties with behavior and play. And what that looks like may be very different from one child to another.
Mm-hmm. Is there a particular age that's too young, or do we really know? Is there a cutoff or anything like that?
That's a great question, because we know early intervention is so important. We want to get in there as early as we can. So when we look at tests for autism, which are standardized tests, meaning that they've been tested through trial and error on a huge population of children that might have autism, we know that it's pretty difficult to diagnose below 18 months. And I think that's probably good. I think to focus on a label or a diagnosis and suggest that we need to do one certain thing, maybe not be in the child's best interest. So 18 months, we can say with some assurance that perhaps if we identify characteristics, those are going to continue through development. However, under 18 months, it's very difficult, but we can rely on specific behaviors. And I think we can even think about children in general. We know that if parents are concerned about children, it's important to address those concerns, no matter if there's a label or not. So I think we take the premise with very young children that there tends to be a category of behaviors that we might be concerned about. But we don't need a label to do something about it, and that's what's
true.
important.
Exactly.
That's truly a good point. And I think that in our work just in the Center for Inclusive Childcare and working closely with early childhood providers, they're seeing a lot more of the kind of hallmark characteristics of children with autism, it seems, in their settings. We're having, a lot of calls about concerning behaviors and that type of thing. And are you feeling like, I know, the waiting list is long, and
yes,
it's a challenge to try to get kids in, to try to reach that diagnosis once they get to that age of...
Sure. We also see that there's a greater incidence of siblings. So if there's a family that already has a child with autism, you can imagine the concern of the parent is just elevated.
Sure.
They don't have a template for what's typical, and so right from the start, they have questions in the back of their mind. And again, we know that when parents are worried, that translates down into the feeling of worried for very young children, and all the excitement about brain and behavior research suggests that, again, we don't have to go into an evaluation with an outcome of diagnosis. It's really, let's address the concerns and what do we do about it. So we see about one child a week that's under 18 months in our clinic, and we've seen children as young as 3 months of age.
Wow. Oh, wow.
Yeah, and again,
That's
maybe
rare.
somebody brought up autism. We're not going to go there, and we're very clear, it's not in the child's best interest, but we can talk about here's a child who's not looking and showing that reciprocity and engagement like we would expect, and that occurs really from very early on. So there are behaviors that we can look at, and if they're off track, we can begin to look at, we may not understand why they're off track, but we can tweak some things so that parents and children can interact and actually change that developmental trajectory in a way that's going to be good for any child.
Oh, that's really encouraging,
Right.
actually.
Very exciting.
So you talked about there's not like a test really, but if a parent came in and they'd been referred either by maybe their school district or their pediatrician, or they just sort of had been on the internet, which I think probably might be the case for a lot of parents, and they were reading up on some different behaviors they were seeing in their child, or however they came to Fraser, for instance. How would you approach a child to see whether or not maybe this was a diagnosis that fit some of the things the parent was seeing, or if in fact maybe they should go a different direction in what they're looking at?
Sure, we're going to do a whole host of things, and like with any young child, it's not just behavior or development in isolation. It is collecting information so that we can understand the whole picture, understand when the pattern of the behavior, what the parent's concerned about. So the kinds of things that we would do upon seeing a family would be definitely to collect a lot of history. What was this child like from birth? What were some circumstances that worried the parent? How did how's mom concerned? How's dad or guardian or caretaker? Who's involved? Who knows this child? And collect all of that information. We might want to hear from the daycare provider as well, because children can respond very differently depending upon the setting. We might need to do some observation. So there are some things to collect that are beyond really what happens in the clinic that are really important to consider. Then in the clinic, there are some things that we would do as well. There is a test called the Autism Diagnostic Observation Scale, the ADOS, and that's commonly used in school settings as well as in clinic settings. And for children age 2 and up, this is a standardized test that we can use to look at behaviors to see what the likelihood is that the child might show behaviors consistent with the population of children that have autism spectrum behavior. So these are play activities, or they call them presses, that we put the child through they look like play, but we're looking at how does that child make eye contact, how do they use language to get their wants and needs met, what do they do when they don't know what to do, how do they problem solve, if they get upset, how do they calm, and it's things that we can observe in the context of play, but it gives us a standardized tool to be looking at that. In addition to that, we also need to look at where are their skills compared to other children their age. And so using a standardized developmental test like the Bailey Scales of Infant Development, if you've heard of that, or the Mullen is another test. There's a whole host of tests that we can use to look at, is the child using words consistent with their chronological age? Are they moving like we expect them to? Are they understanding language? Are they problem solving? Because we need to look at the child in the context of where their skills are. So if a child is 4, but they're functioning more like a 2-year-old, we have to see their behaviors in terms of a 2-year-old rather than a 4-year-old. So there is some complexity. You need somebody that really knows development well. And then there are all kinds of surveys. We can have parents answer questionnaires, and depending on how they answer, we know that their concerns are either in the average range, or they're out of the ordinary. So all kids have tantrums and have upsets and are difficult to calm once in a while, but if it happens all the time, then we start to look at no wonder it's frustrating and challenging to parent this particular child. How are we going to address that? So it's all of those measures, using language measures, using cognitive development measures, using behavior measures, getting history. It's like putting a puzzle together. And to add on top of all of that, not to make it any more complex, is that children can appear differently depending on the day, depending on the week. And so this whole piece of child development, we need to understand that an evaluation is just one point in time. So we probably are going to be in contact with that family over time. And if there's any question, does this fit or doesn't fit, we're going to say, well, let's start with this. I'm not sure it fits, but come back in a certain amount of time. So as you can see, some cases might be very clear and they fit all the criteria. We do look at criteria that are in a manual that talks about autism. And we can go down the criteria, and if the child fits, we use the diagnosis, and it allows us to get funding. If it doesn't fit, we look at some other options. But really, in the end, it's what is the parent concerned about, what are the behaviors that are showing, and then how can we address and change that developmental trajectory.
And I think, as an observer of the process over the years, one thing that is a huge piece that I think that you really focus on is the support of those parents and that family, and to give them an opportunity to be heard and to share their concerns, and just really kind of envelop them with this support system right away at that first connecting meeting. I think just, we understand, we're going to help you find the answers.
It's so true. You can think about this. I mean, the word autism is very overwhelming, but it boils down to some behaviors, and really, it's not the autism that defines the child. That's only one part of them. Just like they have brown hair or large feet, or however you might describe a child. And actually, autism, those behaviors are part of typical development, and they aren't always interfering. And so to suggest all children have the same amount going on, actually some children aren't impacted all that well, and they actually get some gifts from that autism, like a memory that's beyond what I will ever have. And so to be able to say, you came in here and I know you're concerned about autism, but what is the piece that's really impacting your day-to-day life? And if it's around the supper table because the child is not able to sit in their chair, or because they have feeding issues, let's address that. Let's give something that can make your life easier, and let's make it not such a frustrating experience, because that's what's important really about child development.
This is so interesting, Pat, and we appreciate you so much being here. To wrap up, I think what's really important for our listeners also in hearing all this is not just to broaden their perspective and in their understanding of autism, but also just to understand the complexity of a diagnosis, so that people aren't so quick to say, I think this child has autism. And I think that's a really important point that you're making. We'd like to invite you back to continue this discussion around children with autism for our podcast, if you're willing.
Great, I'd love to.
Okay, great. So we will conclude this podcast, and we'll be back for part 2 soon. Thank you both.
That's all for now.